Good morning. Today I'll be taking the class on development disturbances of teeth. Under the development disturbances of teeth, we have size, shape, number, structure, and growth. Under the size, we have macrodontia and microdontia. As the name suggests, it depends upon the size of the tooth. If the size is below normal, it is called as microdontia, and if the size is bigger than the usual teeth, it is called as macrodontia. Under the shape, we have gemination, fusion, concrecence, dilaceration, talus curves, dense indentine, dense invaginatus, and toroodontism, and a supernumerary teeth. The most common which you will encounter in your day-to-day clinical practice is a supernumerary teeth. You should understand what is a supernumerary teeth is. A supernumerary teeth means when there is an extra tooth other than the normal teeth. In a normal permanent dentition, there are 32 teeth, and in decidual dentition, there are 20 teeth. So, in a permanent dentition, if there is an extra tooth, that means 32 plus one more, that one extra tooth is called as a supernumerary teeth. But first, as I told you, between size, it is microdontia and microdontia. Then you have a peck-shaped laterals. The peck-shaped laterals are nothing but you will see a cone-shaped maxillary lateral incisor. They are seen sometime in the oral cavity. They are called as peck-shaped laterals, which are normally seen in a person who has been affected by syphilis. It is a normal oral manifestation of syphilis. He shows a peck-shaped lateral. The lateral incisor is in the shape of the cone. Affects the maxillary lateral incisor. It is a form of localized microdontia. Mesial and distal surfaces they converge or taper together incisally, forming a peck-shaped or a cone-shaped crown. Root is frequently shorter than the usual. Like the size of the root in the permanent maxillary lateral incisor is around 10 mm. So in this peck-shaped lateral, even the root is slightly shorter. The next is gemination. In gemination, in the oral cavity, you will see a tooth, a single tooth showing two crowns. What happens is in gemination, a single tooth bud it divides, and when the tooth erupts in the oral cavity, it looks like the two teeth are fused together. But fusion is when the two adjacent teeth fuse together from crown till the root is called as fusion. In gemination, there is a single tooth bud which is divided into two. So you need to understand at this level what is the difference between gemination and fusion. In gemination, single tooth bud is dividing into two, whereas in fusion, there are two separate tooth buds which are fusing together to form a single tooth in the oral cavity. So whenever these kind of tooth, a gemination or fusion, when they are present in the oral cavity, the count become less. Normally we see 32 teeth or 16 teeth in one arch. When we have a case of gemination or fusion, the teeth are less in number as compared to normal 16 teeth. The site is you can see in deciduous or permanent dentition. Etiology is it can be hereditary tendencies there, trauma to the developing bud, environmental and genetic factors. The malalignment of teeth, arch asymmetry, and there is unaesthetic appearance, which is a problem for the patient. Then you have dense invaginatus. The dense invaginatus, as the name suggests, you see an extra cusp or a tubercle on a premolar. The other names of dense invaginatus are occlusal tubercular premolar, but the most common name by which even sometimes the short note can come is Leong's premolar. Invaginated odontome, occlusal enamel pearl. There is an accessory cusp or a globule of enamel on the occlusal surface between the buccal and lingual cusp of premolars. If you see in this here, you have a buccal and a lingual cusp, and here you can see this globule is an extra globule between the two cusps. It is Lyong's premolar. Develops only in people of Mongoloid ancestry. The pathogenesis is there is proliferation and evagination of area of inner enamel epithelium associated with shovel shaped incisors. The site which is most common is most maxillary, central, and lateral incisor. Then you have anodontia. As the name suggests, anodontia basically means when there are no teeth in the oral cavity or a absence of teeth. Anodontia can be true or false. It can be localized or generalized. True anodontia is when there is absence of both deciduous and permanent dentition are absent. That means there is no teeth present inside the patient. It is called as true complete anodontia. Normally we will see a partial anodontia in which few teeth are missing inside the